This is an SRO crowd. Sellout and standing room. Welcome to the campus here of Eastern State Hospital, and welcome to this important day for the University of Kentucky and, for that matter, the Commonwealth of Kentucky. And due to some earlier events, President Capilouto, who was going to be with us, is staying on campus today. So President Capilouto was to be our leadoff speaker. But we have somebody who's very appropriate for the occasion. Mark Birdwhistle is Vice President for Administration and External Affairs at UK Healthcare. He has served in senior leadership roles in both the private and public sectors, including Secretary for the Kentucky Cabinet for Health and Family Services and Chief Executive Officer for CHA Health. He has over 30 years' experience in healthcare with specific expertise in Medicaid policy. Please join me in welcoming Mark Birdwhistle.
Thank you, Carl. I think we're going to have to update that over 30 years. I think it's over 40 years now. So I'm going to take a little bit of personal privilege here to the people on the front row. We made it. We're here. So they know what that means, and we just want to make sure that we celebrate this day. So as Carl said, Dr. Capilouto could not be with us. If you've seen the news this morning, you know we have issues on campus, and so he's attending to that. So I consider it a very personal honor to be able to stand in his stead here. So pleased to have a couple of our Board of Trustees members, Cammie Grant, Dave Melanson. Thank you all for being here. We have from Congressman Barr's office. Oh, there you are. I couldn't find you. We have Leslie Small. Both Congressman Barr and Senator McConnell have been very supportive of all of these efforts, and that's very important to what gets us here today. So Commissioner Jeff Howard, Commissioner of Public Health, and you'll hear from Deputy Commissioner Stephanie Craycraft in a minute. So at the University of Kentucky, we are putting together a team to address substance use disorder all across our campus. One of the things that you probably heard, since I'm in charge of marketing, I can say this, you've heard the power of. Today we're talking about the power of partnerships. That's what brings us here today. We have partnerships in research, in clinical care. Seth Himmelhoek back there, our new chair of psychiatry. We're putting together a full team effort to address this effort. And it's not just those, it's the entire campus. There's so many I need to recognize. There's so many people, the senior administration at the university. Dr. Capilouto personally is extremely passionate about this issue. I see Dr. Colleen Swartz back there. She has been my sidekick every step of the way. I'd say, Colleen, we got to get this done. I know that people are giving us 40 reasons why we can't do this. I'm giving you one reason we have to get this done. College of Medicine, College of Health Science, College of Pharmacy, our research colleagues, all of this is coming together. And there's a host of people that have made this day possible, from the attorneys, the accountants, the IT people, the contracting people. This has taken a full court press to pull all of this off. So staying on the theme of the power of partnerships. We've had partnerships within the university, but we've had partnerships with outside the university, external partnerships. We've had a long-standing partnership with Chrysalis House at UK Healthcare. So I can't go forward without recognizing Neil Vaughn and Lisa Minton. That's a long-standing partnership, and the fact that you all are in the next door building, it puts the synergistic opportunities between these pre-existing partnerships and takes them to a complete next level. So this entire campus that we're on today is one big partnership, a partnership between the University of Kentucky and the state of Kentucky, primarily the Cabinet for Health and Family Services. Today, we're talking about a partnership that's in a contract relationship with the Department, I always worry about the name, Department for Behavioral Health and Developmental and Intellectual Disabilities. So I never can remember that full name, but this is a significant partnership, and I can't say enough positive things about how this partnership, where UK manages Eastern State Hospital, and now we're partnering on the Beyond Birth. This is what's good about the university, and the university, as Dr. Capilouto says, the university for Kentucky. So with that, I'm going to turn it over to our next speaker, but thank you all for being here today. Keep in mind the power of partnerships.
Very well said, Mark. Since 2014, Dr. Janie Heath has served as Dean of the University of Kentucky College of Nursing and as Warwick Professor of Nursing. Dean Heath has more than 43 years, she started when she was 7, more than 43 years of acute and critical care nursing experience in staff and administration positions to advanced practice and academia. She's been awarded more than $12 million for academic and/or research initiatives, generated more than 150 publications and abstracts, served on numerous regional and national task forces for tobacco control and advanced practice nursing initiatives. Recently, she was honored as an inaugural distinguished alum at the University of Oklahoma College of Nursing. Please welcome Dean Janie Heath.
Good morning. I am truly honored to be standing before you today for such an historic moment for the College of Nursing, the university, and our beloved community. First, I'd like to thank University President Dr. Eli Capilouto for his continuous support in ongoing efforts to strengthen the university's strategic goals through innovative research and practice. I'd also like to thank Mr. Mark Birtwistle for his relentless guidance in opening the Beyond Birth Comprehensive Recovery Clinic, as well as 2 of our outstanding academic nurse leaders and colleagues for their resilience to help so many women have hope and prosper with their lives. Dr. Kristen Ashford, Professor and Associate Dean of Undergraduate Faculty and Interprofessional Education Affairs, who has been and continues to be a pioneer in her field of maternal child health research. She is truly a champion for these women and their families, and I know through her passion and her leadership, this is only the beginning. Dr. Colleen Schwartz, raise your hand as you're fanning. It's a room full of lots of love and warmth. Dr. Schwartz is our Chief Nurse Executive and Chief Administrative Officer at UK Healthcare, who has always been our Chief Navigating Officer and Chief Supporting Officer for all things possible for the College of Nursing. Thank you, Colleen, for your endless meetings, conference calls, and road trips to make today possible. As we all know, the world around us rapidly and significantly changes every day. For every step we take forward, a challenge arises that tests our commitment to our values and aspirations. The growing epidemic of opioid-addicted moms has ignited a new challenge in the Commonwealth to bring holistic care to an at-risk population. In addressing these challenges and helping these women, the Beyond Birth team provides extended care for moms after delivery of their child, while at the same time helping them adjust to becoming a new mom and staying in recovery. This program integrates educational groups, individual counseling, group counseling, peer support, and the medical treatment of substance use and mental health disorders. A signature component of the Beyond Birth Clinic is for women to bring their infants and children with them, so our team can offer a more comprehensive and compassionate care delivery model for a healthier environment for one and all to flourish. This is innovative and critically needed to optimize maternal-child health outcomes. This approach is deeply rooted in the university's mission to improve people's lives through education, research, and service. As Mark said, our president, Dr. Capilouto, always says, we are the University for Kentucky, a distinct honor in the Commonwealth, the nation, and the world. Nursing is on the front line of quality health care delivery, and I could not be more proud of Dr. Kristen Ashford and her team in meeting this monumental milestone day for helping us advance health and wellness in Kentucky. Let's give them a round of applause.
Thank you, Dean Heath. As you heard, Kristen Ashford is Professor and Associate Dean of Undergraduate Faculty and Interprofessional Education Affairs at the UK College of Nursing. She received a bachelor's degree in nursing from Washburn University, a master's from the University of Louisville, and her doctorate in nursing from the University of Kentucky in 2007. In 2017, just last year, she received the Hillman Innovations in Care Program grant from the Rita and Alex Hillman Foundation, which enabled her to continue to expand the perinatal assistance and treatment home, known as Pathways, and Beyond Birth programs. Please welcome Dr. Kristen Ashford.
Good morning, and thank you for being here today. I just can't tell you how heartwarming it is to be here. And for Nancy's relatives, Aunt Nancy, your namesake, Uncle Jim, and for Miss Sadie Sachs, who came here from Orange County, California. I think you get the award for being here for this, so thank you for being here. 4 words come to mind when I think about this program. First is prayer, second is people, third is partnerships. Thank you for addressing that so well. And the fourth is perseverance. So I'm going to start with a quick prayer that's really helped me throughout our days. It's from Philippians. Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds. So that certainly has been helpful for me and encouraging. But the people, it certainly is not without people that we wouldn't be here. And there's so many in the room. I want to recognize everybody, but there's some in particular that have just been so instrumental. And first, I'd like to thank Dr. Michael Kindred. It really wouldn't be without his direction and his vision of having comprehensive treatment that we'd be here for today. He is addiction medicine specialist, and without his direction, support of psychiatry and Center for Drug and Alcohol Research, and all the other people at Kentucky, thank you. We wouldn't be here today without you. Other people, obviously, Dr. Mark Birdwhistle, Dr. Colleen Schwartz, Gwen Moreland, Holly Dye, who has been really the heart of the program, Nancy Jennings, the glue. We refer to it as the glue all the time, the glue, and Sarah Bell, really for the peer support leadership that you've given us. Our Pathways partners, there's so many of you in the room. I'll start with the journey, actually look at my notes here for a minute so I can say some to all that you have done to help us as well. Our journey began in 2014 after we received a Medicaid grant to provide group prenatal care to high-risk women. At this time, the opioid epidemic was on the rise, and we realized nearly half of our high-risk women that were using tobacco were also using illicit drugs, primarily heroin and prescription opioids. This group prenatal care, with the addition of medication-assisted treatment, and that was really under the direction and leadership of Dr. Agatha Critchfield, mentorship with Dr. Michelle Loftwall from Center for Drug and Alcohol Research. They helped get the medication piece to our program that was really missing. And thank you, Sharon, also for being here. So, Pathways, there's Jason, there's Nancy, there's Heather, there's Diana, there's Linda, there's Beth, Who am I forgetting? I don't want to forget anybody. You all were the heart of Pathways, and without that start, we would not have been able to be here without the transition. Pardon? Karen. Oh my gosh, Karen. I'm so sorry, Karen. Karen, yes, social worker extraordinaire. Thank you, Karen. I'm so sorry. And if there's anybody else, I apologize in advance. But thank you, because that partnership is going to mean everything moving forward. But now we can go beyond UK and go to the community and get more patients in women in our program. So, make a long story short, we heard that the program only provided the services for 6 weeks. And I think we all know that moms at 6 weeks are a little bit stressed, a little bit higher rate for depression, anxiety, sleep deprivation, and relapse. And so we needed more support. And actually what really happened, of those of you that know Nancy, she's pretty direct. And so she said, call me, and I vividly remember, Sarah and I are talking, and we got to do something more for these women. We can't just let them go off. They're calling us to come back. And so Beyond Birth was literally birthed out of Nancy and Sarah's vision to do the next right thing. Jason Joy. Where's Jason? I knew I'd forget somebody. Sorry, Jason. Peer support extraordinaire. And so birthed out to do the next right thing, and the next right thing has become our mission. After the Pathways, the next kind of phase of Beyond Birth, Dr. Kindred and Holly, and many of the other partners began the program. Dr. Kisa Bennett also provides family services from Family Community Medicine. But we're privileged to be able to provide these services long-term care. We have already talked a lot about partnerships, so I'm not going to go there, but without the state and UK Healthcare, the College of Nursing, and all the staff at the College of Nursing and Research, thank you so much for our help. We've expanded from about 3 people to 9 people here at the Beyond Birth clinic. We have nurse practitioners, nurses, behavioral specialists, a new great social work team, behavioral health, peer support, CSTs, and currently we've served about 250 perinatal women. Many of them on the path become peer mentors or peer support specialists. We want to give them a purpose. That's what they want. They want to be mothers, and they want to have a purpose. And thank you to Sadie Sachs for the generous donation. She's also provided for scholarships for our mothers to become peer support specialists. Several of them, including Bethany, are here today and are part of that scholarship. So thank you so much. In addition, we've received a large Medicaid grant, and thank you to Jeff Talbert, Camden, Dr. Liu, and all the other funding that have made this possible. Goodness, we currently serve 45 counties and counting, and we hope to get closer to the communities and expand telehealth services. Dr. Kindred has a lot of vision for training programs for other healthcare providers, and so we look forward to those expanding those services as well. So we are definitely committed to doing the next right thing. Thank you so much. And in closing, I want to share just a couple comments from some of our mothers. They say they don't feel judged. They say, I'm very thankful for this program because I'm here. I'm just not wandering around existing. I'm living a life, and it's very beautiful. One said, I get very emotional because my children now have a mother. My son will never be without a mother, and I can fully protect my children now. So thank you so much for being here.
Thank you, Kristen. Our next speaker is Stephanie Craycraft. She is the Deputy Commissioner at the Department of Behavioral Health, Developmental, and Intellectual Disabilities in the Kentucky Cabinet for Health and Family Services. If you would, please welcome Deputy Commissioner Craycraft.
Good morning. I'm happy to be here this morning on behalf of Commissioner Wendy Morris, who unfortunately had a previous commitment and is at the far western end of the state this morning. In 2008, the General Assembly authorized a $129 million project to build this amazing state-of-the-art campus for Eastern State Hospital. That project included the Central Kentucky Recovery Center, 4 personal care homes that were designed to provide a continuum of care for adults whose lives have been impacted by serious mental illness. Unfortunately, in 2013, well, actually fortunately, but in 2013, when the hospital opened, the Cabinet for Health and Family Services entered into a settlement agreement of protection and advocacy. And that protection agreement, the Cabinet embarked on an initiative to expand programs and supports to allow individuals with mental illness to live in the community instead of personal care homes. So due to budgetary limitations, as well as that initiative, this asset, these 4 personal care homes, have never been fully utilized. So we are delighted that the University of Kentucky has chosen to locate the Beyond Birth program here in this facility. On a daily basis, there are so many Kentuckians impacted by the opioid epidemic. The individuals that are dependent on opioids, their families, their friends, their employers, first responders, hospitals. It's hard to find individuals that are not impacted. As the State Mental Health Authority, the Department for Behavioral Health, Developmental, and Intellectual Disabilities has been fortunate to receive 2 federal grants that total $42 million to develop and provide services that are targeted to address this opioid epidemic. The University of Kentucky is an important partner to the Cabinet in providing those services. We're partnering with them to conduct needs assessments, program evaluations, and research that's required by the grants. For the UK Pathways program to expand consultation and telemedicine services to pregnant women in eastern Kentucky, to prevent overdoses through the distribution of naloxone in the UK Emergency Department, and also for individuals that present at the emergency department with an opioid use disorder, the Bridge Clinic, which is an important service. It provides outpatient treatment services to individuals, peer support services, and other supports and services that allow them to be successful in their recovery. We are also have an extremely valuable partnership with UK in the operation of Eastern State Hospital and Central Kentucky Recovery Center. We're happy to continue expanding our efforts with UK to address behavioral health needs in the Commonwealth. In March, I was fortunate to meet with Dr. Ashford in March to discuss the possibility of locating the program here on the campus. I was touched in that meeting to learn of some of the success stories and also to see the dedication Dr. Ashford has in meeting the needs of the women and children she serves. So we're extremely excited to see the expansion of this program.
Thank you, Commissioner Craycraft. When Bethany Wilson joined the Beyond Birth program in 2016, she'd been active in addiction or inactive addiction for 5 years. She's endured endocarditis, a valve replacement, organ failure, reinfection, and being told there was nothing more doctors could do to save her life. Today, she is the mother of 6 healthy children, a newlywed, a certified peer support specialist, and she advocates for those with substance use disorders. With 34 months of recovery under her belt, Bethany uses her voice to let others know there is hope in the darkness. There's a life beyond addiction. Please join me in a warm welcome for Bethany Wilson.
I would like to thank everyone for being here today and supporting the University of Kentucky Pathways and Beyond Birth programs. I would like to say a special thank you to those who have been a part of supporting and loving me, even when it has been tough. Thank you. Throughout this journey that has led me to where I am today. I grew up in a small town. My parents are still married. I didn't come from a broken home. We always had everything we needed in terms of food, shelter, love, and support. I graduated high school with good grades. I was a cheerleader. I had been employed basically since I was 14. I say all that to tell you that addiction does not discriminate. It affects all ages, race, genders, ethnicities, and economic backgrounds. By 23, I was a wife, a mom to 3 children. I had a career, but I was also experiencing an overwhelming and unusual amount of stress. It was a very emotional time in my life. I was dealing with undiagnosed and untreated postpartum depression, as well as anxiety. I was emotionally and physically exhausted and not taking care of myself properly. Those things, in combination with previous exposure to medications due to health reasons, which made me aware of how certain medications could numb myself both physically and emotionally, all played a role in my decision to use. I lacked knowledge about drug use. I was unaware of the term withdrawal and what that meant. I, of course, did not know the devastation that this could cause. If I would have had this knowledge, I believe that I could have made a more informed decision even in the midst of my desperation. With that being said, desperate to feel anything but the pain I was feeling, I began to use. I would soon realize that I have a substance use disorder, and I was unable to stop using on my own. My substance use escalated very quickly. A couple months after my first use, I ended up at the hospital with an abscess in my right arm that required surgery. Over the next few months, or few years, I tried multiple times to get sober with no real long-term success. I had been in inpatient treatment, intensive outpatient treatment, jail. I suffered multiple consequences because of my continued use, such as divorce, loss of custody of my children, illnesses, but I still was struggling to be sober. In 2014, I ended up in the hospital and diagnosed with septicemia, endocarditis, triple pneumonia. I had suffered a stroke, liver and kidney failure, and congestive heart failure. After surviving what others thought to be not survivable, I still struggled to stay sober. I spent some time incarcerated and in treatment, but again, I still struggled. I became pregnant and went to see an OBGYN, and because of my substance use history, I was referred to Pathways. Little did I know that participating in this program would be the beginning to the rest of my life. I was required to go to group therapy, individual therapy, parenting classes, and attend regular doctor visits. I initially did not like having all these requirements. I know some of them can remember me being kind of angry. But I later would realize that the accountability and structure was exactly what I needed. I grew to love the group therapy settings and getting feedback from my peers. We were taught to take that back to our communities and to get involved in local support groups. After giving birth to a healthy son in June of 2016, the Beyond Birth program offered me the support I needed to complete a case plan with my children. I began to think about my future and what I wanted to do as a career. I expressed interest in getting my peer support certification. The program not only provided me with the paperwork needed to apply for the certification, but they attested to my progress in recovery for the application process. They helped provide me with a scholarship to cover costs of the training and supported me emotionally through that process. After completing my training and exam, I began searching for job positions. They were able to help provide insight on available job positions, and in February of this year, I began working as a peer support specialist. I am now working for a nonprofit organization. It's AIDS Volunteers Incorporated as an HIV prevention specialist. In April, I got married. I'm an active parent in all 6 of my kids' lives. I'm a productive member of society. I have been sober for 2 years and 10 months. I share my story for the family members and friends of loved ones with substance use disorder, for the person who is still suffering, and for those who are unable to share their own stories. I know many people who have success stories similar to mine, but unfortunately, due to stigma around substance use disorder, more specifically medication-assisted treatment, they do not feel comfortable sharing their experience. If it is not talked about, nothing will change. If something is not done, nothing will change. A famous quote, if you always do what you always did, then you'll always get what you always got. And this is so true. So thank you to this program for doing something different, for taking the information at hand, recognizing the problem, and working towards a possible solution for many to that problem. Thank you.
Thank you so much, Bethany. There's absolutely no way to follow that. But what a great story, and it shows there's hope, There's hope for every one of us, every person. And now there's professional help at the highest level available. Thank you for sharing your story. This concludes the more formal part of our announcement and news conference. We invite you to go outside if you want to get a little cooled off. I'm sure that'll happen. But we're going to have our ribbon cutting outside the front door, so we'll take a few minutes to get out there. We ask that our speakers and some of the other people, you know who you are, we're going to have your picture taken cutting the ribbon. And our speakers will be available for one-on-one interviews after we conclude the ribbon cutting. Thank you all for being here, and congratulations to all in the room and elsewhere out in the hall who've worked so hard to make this a reality. It's a wonderful thing to learn more about. So thank you. If you have to leave, we appreciate your attendance. Have a great day.